All right. So you need to know front, back, left, right. Okay, so if you get that wrong, everything's going to be wrong.
Okay.
So you look for this sulcus right here. See this diagonal line across the heart? That's the front of the heart. And that in that little fissure right there is where the coronary vessels lie, and then they're covered with fat to protect them. Okay, so that's the front of the heart. And the apex of the heart, the point, that's the bottom of the left ventricle, the bottom of the left side. So if we hold our heart up like this, all of this stuff here below that diagonal line, below that sulcus, is left ventricle. This stuff over here, this is all right ventricle. Okay? So those are the two bottom chambers, and then we have the two flaps up here. This is the left auricle or left atrium, and this is the right atrium on this side. Okay? So those are the four chambers. Then it tells you to look for the vessels. Okay. This vessel right here, the one that's most anterior and kind of runs horizontally across the front of the heart, that's the pulmonary artery. Okay, remember, arteries carry blood away, veins bring blood back. Okay? This is the pulmonary artery, so this is carrying oxygen-poor blood out to the lungs to pick up oxygen. Okay? Then if we look at this big tube right here, right up and down, that's the aorta. Okay, that's the largest artery. And this one's actually cut a little close for the aorta. We can look at this one. This is the front of the heart. Again, here's the diagonal line. Here's the pulmonary artery going across the front. Here's your aorta, straight up and down. And what this one, you can't see in this one, is this branch right here. This little branch off the aorta, first branch off the aorta. That's the brachiocephalic artery.
Does it go all the way through? Like you can stick that through? Okay.
Okay. So the big one straight up and down is the aorta, but the first little branch coming off is the brachiocephalic artery, and that branch is left and right for the upper body. Okay? Okay. And now we have we have that oxygen-poor blood coming back to the heart to get pumped to the lungs, right? Oxygen-poor blood comes back to the right side. And it comes back through the largest vein in the body, which is the vena cava. Okay, so if we look on the back of the heart, if I can get that probe through there. Okay, so this is the back of the heart, so I'm turning it around so you can see. Okay, on the back of the heart, you see you have an inferior vena cava, which is going to bring that oxygen-poor blood up from the lower part of the body, and you have a branch that's the superior vena cava, which is draining the head and the upper body. Okay, and both of those combine to put oxygen-poor blood into this right upper chamber, into this right atrium. Okay? All right. So then after the blood goes out through that pulmonary artery, goes to the lungs, gas exchange happens. Now we got to bring that oxygen-rich blood back to the heart so we can pump it around the body. It comes back to the heart through 4 large pulmonary veins. Okay, 2 from each lung. And those actually come into this great big hole here. There should be 4 little holes here. They cut it a little bit further out. But all that oxygen-rich blood comes back through those pulmonary veins right into that left atrium. Okay? And again, just to review blood flow in the heart. So the oxygen-poor blood comes back to that upper right chamber called the right atrium. Okay, that right atrium contracts and sends it to the right ventricle. The right ventricle contracts, sends it out through that pulmonary artery, out to the lungs. Okay? Blood comes back through the pulmonary veins, that oxygen-rich blood, to the left atrium. The left atrium contracts, sends it to the left ventricle. Left ventricle contracts, sends it out through the aorta. Okay, so you have 2 circuits of circulation, 2 separate circuits. You have the pulmonary circuit, which goes from the heart to the lungs back to the heart, and you have the systemic circuit, which goes from the heart to the body back to the heart. And the 2 are totally separate. Okay? In utero, you don't need to use your lungs because the blood's already coming in oxygenated right from the mom through the placenta. So in utero, you actually have a direct connection between that pulmonary artery and the aorta called the ligamentum arteriosum. You don't need to use the lungs, so why bother? Let's just send it out to the body.
Yeah.
So we just bypass that whole circuit. We go right to the aorta, it goes right out to the body. And then as you grow in utero, that connection eventually closes off. Preemies, because you're born too early, can still have that connection.
Yeah, because aren't the lungs like later, like
the lungs are one of the last things to develop, to fully develop. So
that makes sense. That's why they always have respiratory issues when they're preemies.
Yeah.
Good job.
So provided the preemie is healthy, otherwise they'll generally just keep it in the NICU and let it come to gestational age, and a lot of times that closes off by itself. And if not, then they just go in and close it off. Okay. Good.
Yeah.
We're good with external.
Yep.
Okay. Now let's go for internal.
Dun, dun, dun.
We open up our heart. Why is it packed?
Is that
This
easier
one's
for
better
you?
probably.
Or do you want when it's combined already so it can be closer?
I don't like when it's combined.
Well, this one's all right, I guess. So the first thing we notice again, this is the apex here, so this is the left side, okay? And this is the right side. And the right side is much smaller, which makes sense because the right side only has to pump to the lungs. The left side has to pump to the whole body, okay? And in your lab book, it's asking you to identify different layers of muscle here. You can't see different layers. Just call this all myocardium, which most of it is anyway. Myocardium. Okay? But it lists all the different layers. You can't see them anyway. Okay? So if we look on the inside here, so this is the right side. So this is the right atrium up here, this little, what's left of it, okay? And if you look inside there, you can see all the little bumps on the inside of the atrium.
Yep.
Okay, that's pectinate muscle. Because remember, the atria have to contract as well. So that's pectinate muscle. Now there are valves between the upper chambers and lower chambers to regulate flow through the heart. Okay, and the valves between the atria and the ventricles are cuspid valves. And a cusp is a flap of tissue. So if we look at our right side here, so the blood's going to come in here, right? The oxygen poor blood comes back from the body, comes in here. This is going to contract and send it down into the right ventricle. To get there, it has to go through a valve. And these little pieces of tissue right here,
Great thing.
right, those are the cusps. Okay, little flaps of tissue, that's what cusps are. Okay, you can see them on that side too. All right? And you'll notice that those cusps are anchored by these little strings. See those little strings in there, right there? Those are called the chordae tendineae, or tiny tendons. And those, in turn, are anchored to the wall of the ventricle by this muscle right here. There's bumps right there. And that's called papillary muscle. Okay? So here's your cusp, here's your chordae tendineae, here's your papillary muscle. Okay? And when the heart contracts, it puts tension on those tendons, it pulls on them, and that closes the valve. And then when the heart relaxes, tension is released and the valve is open, so the blood can come back through. Okay? So that's on the right side. On the left side, you have a similar situation. You have, this is what's left in here of your left atrium. Okay? So we have all that oxygen-rich blood come back from the lungs into the left atrium, and now we have to send it down to the left ventricle. To get there, you have to, again, go through a cuspid valve, and this is one big cusp here. This is a bicuspid valve on this side.
Is that the only side that has the bicuspid valve?
The right is tricuspid, the left is bicuspid.
Okay.
Okay? So here's the cusps again of the valve, these flaps of tissue. And again, you can see the chordae tendineae anchored to the big papillary muscle. Okay? In addition, on the left side, you see all this down here at the bottom of the ventricle, all these ridges down here? That's actually an extra set of muscle called the trabeculae carnae muscle. And that allows that left ventricle, that left side, to contract hard enough to get enough blood pressure to pump blood around the body through that big aorta. Okay? So again, here's our cusps on our bicuspid valve, our chordae tendineae, our papillary muscle, our trabeculae carnae muscle.
The papillary muscle on the right side is the
on
wall.
the side.
Is on the wall. It's much smaller. Again, it's much. You can't
Which
see anything
everything
on
on
the
that
side.
side is smaller than.
Everything on the right is smaller. It's just these little bumps
little
here.
bump, okay.
Yep. As opposed to over here, much bigger.
Here's one.
Yep.
And what are those little bumps again called at the top of the atriums?
Pectinate muscle.
Pectinate.
On the inside of the atrium, those are pectinate
It looks like
muscles.
little holes.
They're like little
Yeah, little
dots
ridges
or
and
whatever,
things in
yeah.
there.
Okay.
Okay. Also on the right side, something they like to ask you about. If you look on the right ventricle, you see this little thing looks like a rubber band.
Yeah.
That's called the moderator band. To
Moderator.
regulate contraction or something. I don't know. In the sheep and in the cow, we don't have it.
We don't have it? Okay.
We don't have it, but they always have a clip on that. So that's the moderator band.
Moderator gland.
Okay, in the bottom, in the right ventricle.
Moderator gland.
Okay. So now once we get the blood into the lower chambers, we got to pump it out of the body. If it's on the right side, that right ventricle is going to contract and send it through the pulmonary artery out to the lungs. Okay, so if we look, let's look at this one because it's cut better to looking at this. So here's our pulmonary artery right on the front of the heart. Okay, so there is a valve right at the beginning of that pulmonary artery that's going to regulate flow. And the valves that are on the vessels coming out are called semilunar valves. And semilunar valves are a little bit simpler looking. I'll hold this open to show you. Okay? Semilunar valve is simply flap of tissue right there.
Like a pocket.
Yep, on that side, and then the other half is kind of ripped, but it's over on this side.
So it's just
Okay.
it's not really.
It's just two little flaps of tissue that just kind of open and close.
Okay.
Okay? So it's a semilunar valve. It's just a flap of tissue on that side, and it's ripped on this side, but here's the flap on this side. Okay? And that's the pulmonary semilunar because it's at the opening of the pulmonary artery. Okay? Likewise, if we check out, going out to here's our aorta, right? Here's our big
Goes all the
aorta.
way in the middle.
Okay? So here's the opening for our aorta. So now we have blood in this left ventricle. We have to get it out the aorta. It also is going to go through the aortic semilunar valve.
Oh, but they look exactly the same. That's funny.
Yeah. Okay, again, it's just a little flap of tissue.
I don't know why.
Okay? My husband has an artificial one. I was telling one of the other groups. His was defective. So he was actually getting flow. Every time that left ventricle would contract, blood would leak back down into the ventricle, so that it was actually causing his heart to enlarge on that side. It was really cool if you look at an echocardiogram. It's really pretty cool to look at. But anyway.
And then
so they
that's just like they put a flap in there basically.
What they did was they took out they cut that out and they put in something that's slightly bigger than a quarter.
Yeah.
This round thing with Dacron fibers around the outside of it, and just this little flap.
Where do they get that from? Like it's
That
like
flip
a
flaps. It's a metal.
yeah, so it's not like
titanium.
Oh my god, that's weird.
Yeah, he doesn't
Does he
go
go
lumped
off
up. He
during
goes
like
tick, tick,
airports
tick,
and
tick,
stuff?
tick, 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 tick. No.
Oh, so that would be annoying.
Nope.
It's
just
in my heart, I swear.
Yeah, it's just annoying to listen to
Yeah.
sometimes.
Really?
Okay, so that is the aortic semilunar valve. All right,
Got it. Aortic semilunar.
and they also talk about the coronary sinus. So you have your right atrium. So you have your inferior vena cava coming in, your superior vena cava coming in, bringing all that oxygen poor blood back to the right side, right? You also have just medial to where that big hole comes in to the right atrium. You have another little hole that's called the coronary sinus, and that's where the coronary vessels come back to the heart or dump into the heart. The vessels that are actually feeding the heart muscle themselves. We also have to get that oxygen poor blood back to the lungs, so it comes in through that little hole called the coronary sinus, but you can never see those anyway.
So we might not really need
No,
that.
but if you're going through your list,
Note
just know
stuff,
that
that's where it
what
is.
that is.
Okay.
And they also ask you about different layers of muscle on the aorta, but you're not going to see that yet.
Okay.
Okay,
That's it?
that's it.
Oh, that's not bad.